AlohaCare is now offering members the benefit of Native Hawaiian healing traditions. And joining me to talk to us and tell us all about it is AlohaCare CEO, Francoise Cully Trotman. Thank you for joining us.
Absolutely. Thank you for having me.
Now, can you tell me a little bit about the new Native Hawaiian healing services that are being offered?
Yes, we're very happy to announce the launch of Ke Aloha Mau, culturally responsive services that target mental, physical, and spiritual health. So we're going to start by offering hula and lomi lomi, Native Hawaiian physiotherapy and massage, and then we'll expand with additional providers. We're also going to offer Aipono, featuring very healthy Native Hawaiian food and meals, and Ho'oponopono, which focuses on balancing of relationships. So these are value-added services because in our industry, Hawaii's MedQuest division doesn't cover this as part of the suite of benefits. There's something that we do as an investment in whole person care. For example, we've been covering adult dental services also.
And as we're looking at Native Hawaiian healing traditions, all the different ones that you just mentioned, why did AlohaCare think that these offerings were particularly worthwhile for the community?
You know, the pandemic really highlighted the disparities that we very well knew existed in our communities, especially in certain areas. We saw the successes that our community-based organizations had in really connecting with their communities and uplifting them with much needed services. They were doing such inspiring work. And so as we started our contract implementation planning for the MedQuest contract, we reached out to those community providers. And they helped us to understand the community's needs. We were able to do listening sessions with people in the community. And so we were very intentional about moving forward with culturally responsive care. We are offering what the community asked for via their feedback. The other thing is we've been collaborating with Papaola Kahi, who, of course, have existing connections in their communities. They're very embedded. And so those relationships allow us to better understand where our members live. And then Papaola helped to bring those established relationships with Native Hawaiian healing providers. And much like AlohaCare, they also collaborate with FQs to improve health outcomes for members and their families. So the net is that these benefits really resulted from listening to the community's needs, collaborating with organizations who understand their needs, and then partnering with trusted practitioners to deliver services. Our overall goal is always to improve health outcomes, and this program offers the perfect opportunity to expand services, but also to offer traditional Native Hawaiian practices that are known to be beneficial to whole person care.
So I know you're going to start off with offering hula and lomi lomi. Are those already available, or when will those become available? And then when are we looking at expanding to that Aipono and Ho'oponopono?
We've started doing the work with the practitioners. And so in July, as the new Medicaid contract really comes into effect, members will be able to start using those services. And we also, we offer easy ways to connect and access the services. And so we will have that information up on our website, and we'll also be distributing informational materials.
So I guess, of course, the big question everyone wants to know is who is eligible to take advantage of these new offerings, and how can you take advantage of these?
Yeah, so we're happy to share that our members that are age 16 through 64 who live within any of the service areas where the providers offer services are eligible. Our members can call our main service number, which is 808-973-0712, or they can email us from the website at alohacare.org, and one of our representatives would be happy to sign them up.
And one more question before I let you go is, out of the different offerings, the hula, the lomi lomi, the aipono, the ho'oponopono, is there anything that you're extra excited about, maybe about being able to offer, or that you're excited about maybe trying yourself?
I absolutely love the concept and idea of Ho'oponopono, the balancing of relationships. We are in what can easily be called the most stressful of times. And I just think it's wonderful that we're able to provide a service that encourages open discussions and provides supportive, resources for our members. So I'm personally excited about that.
That one stuck out to me too. So I'm right there with you. But thank you so much for joining us, Francoise. I really appreciate it.
Thank you. Aloha.
Yeah, I really enjoyed that as far as the, massaging of not just your body or mind, but also your soul.
Some awesome offerings there.
Yeah.
And we're going to have that full interview on our website, KIDTV.com, after the show, so you can find out how you can take advantage of those offerings as well. Lomi Lomi always sounds good.
Exactly.